Perform hand hygiene and ensure patient privacy. Introduce yourself to the patient
Hi, my name
and
is
identify the
Brian. I'm gonna
patient
be your
using
nurse
two
today.
identifiers.
Can I see your ID band, please? Can you give me your first, last name, and date of birth?
Michael Williams, January 23rd, 1961.
Okay, great.
To assess a
going to be
patient's
checking your
respiration,
breathing or your
first check
respiratory
for
rate today.
factors that can
Are you having
affect
any
respiration, such as
anxiety or
exercise,
pain or taking any
anxiety,
medications that would
acute
affect your
pain,
breathing or respiratory rate?
smoking, and
You're not?
medication.
Great. Okay, well, what I'm going to do is I'm going to raise your bed and then raise your head, and then I'm going to check your respiratory rate. Okay, sir? I'm going to have you lay on your back for me.
Help the
and then I'm
patient
gonna
into a
raise your
comfortable
head.
position,
There you go.
preferably sitting or lying with the head of the bed elevated 45 to 60 degrees. Make sure his chest is visible, moving the bed linen or gown as needed.
Okay. Just relax for me.
Next, place his arm in a relaxed position across his lower chest or upper abdomen as you would to assess his pulse, or simply place your hand directly over his lower chest or upper abdomen. Observe a complete respiratory cycle of 1 inspiration and 1 expiration. Then, look at your watch. When the second hand reaches a number on the dial, or when the digital display reaches a round number, begin taking the respiratory rate, counting 1 with the full respiratory cycle. If the respiratory rhythm is regular, count it for 30 seconds and multiply the number of breaths by 2. The respiratory rate normally ranges from 12 to 20 breaths per minute. If the respiratory rhythm is irregular, or less than 12 or more than 20 breaths per minute, count the breaths for a full 60 seconds. As you count the rate, note the depth of the respiration by observing movement of the chest wall, or do this after counting the rate by palpating chest wall excursion or auscultating the posterior thorax. Describe the depth as shallow, normal, or deep. Also note the respiratory rhythm, which should be regular and uninterrupted, except for an occasional sigh. Observe for dyspnea and ask the patient to compare any shortness of breath to his usual breathing pattern. Adjust the patient's bed linen as necessary and discuss your findings with him.
Mr. Williams, have you had any breathing problems?
No?
Okay. Well, your respiratory rate, your breathing rate was 16, which is within the normal range. Okay. So I'm going to get you back in the position that you were and make sure that you're comfortable. And you just let me know if you need anything, okay?
Okay, thank you.
As part of your follow-up, compare your patient's respiration with his previous baseline and with his usual rate, depth, and rhythm. Correlate the patient's respiratory values with his pulse oximetry and arterial blood gas measurements if they're available.